Good afternoon, and you are listening to Live Pono, Love Pono, and I am your host, Alex. Today, we'll be talking about a super important topic that is intergenerational trauma within the Asian, American, and Pacific Islander community. I'm so excited to introduce our guest today, Francis Joseph Gallego, LCSW, brings over 20 years of experience to supporting clients with stress, anxiety, LGBTQIA related issues, family conflicts, and trauma with respect and compassion, emphasizing cultural humility and diversity. José Barzola is the host of the August 23rd event, and he's dedicated to fostering social change through nonviolence, promoting diversity, inclusion, and equity. He's currently serving as the Conflict and Peace Specialist at the University of Hawaii at Manoa. I love Pono. Our game, our I love Pono. Our goal is violence prevention, and our efforts are deeply intertwined with understanding and addressing intergenerational trauma. By acknowledging the historical and systemic roots of trauma, we create programs that foster healing and resilience across generations. Our approach emphasizes community empowerment and culturally sensitive practices, ensuring that the unique needs of each community are met. Through education, support, and advocacy, we aim to break cycles of violence and promote lasting holistic healing. So, that being said, we're super honored to have the guests here today. Again, this event is going to be held on Zoom, and it's August 23rd at 12 p.m. Hawaii Standard Time. And you can find the event on Eventbrite and through all the different emails that are circling out now. And I'm sure Jose will kind of give us a better point of reference of where to find the event and get signed up for it. So just want to say as well, this podcast is done in combination with Jose's Peace Building Initiatives YouTube channel. And we're so thankful and lucky to be kind of partnering up. And we're really glad that you folks are listening today. So just to kind of get started off, can you both share a little bit about the impact of intergenerational trauma on the Asian American and Pacific Islander community? And what you hope people will learn from the webinar on the 23rd? And also please take a moment to introduce yourselves.
Francis, you want to go or you want me to? I
You
already
can go.
started talking, so
You can go.
wonderful. Thank you. Well, thank you so much, Alex, for having us here and for Love Pono for bringing us together. I really appreciate the opportunity. It seems so synchronous. A big portion of, so as Alex mentioned, I am the Conflict and Peace Specialist here at the University of Hawaii at Manoa. In my positionality, I provide conflict services, mediation facilitation services, student to student, student to employee, employee to employee situations that may arise. And then I also develop programming. And at the core of a lot of the programming that I do, it's about how do we develop some healthy, positive relationships. And really, initially, it's about having dialogue, conversations, whether they're in person, whether via Zoom, whether it's over a phone call, just getting away from the writing aspect of it. Not that we can't, convey wonderful emotions through that, but many of us unfortunately are not trained to do that. And so getting face to face or being able to hear people's tone and voice, that's really at the core dialogue of what we're doing. Going to your question about a little bit the impact of intergenerational trauma in the Asian American Pacific Islander community. In my life, history, I've worked with lots of different communities, not, everywhere from the Latin American community to the continental US community, having grown up on the East Coast and being an immigrant as well, but also having been here in Hawaii for some time, gotten very much immersed with Asian American Pacific Islander community. And I find that a lot of it comes down to, in my perspective, just a lot of lack of opportunities. It's and for what I'm getting at is, not having the right resources, whether it's healthcare, whether it's education, and that kind of there's a cycle of oppression that we need to kind of break. Thankfully, education has been a wonderful opportunity to enlighten many of us, and I think that's kind of what initiated a lot of these like podcasts and YouTube channels. When we started the YouTube channel, it was really the idea of creating content during the pandemic, beyond whatever the streaming services had. It's an opportunity to engage, an opportunity to put on the platform that we all can really learn from each other if we're provided the opportunity to do so. Uh, whether whatever, whether you're in high school, whether you're retired and everything in between, and whatever your life story may have been, you don't necessarily need to have, you know, finish high school to be a speaker. It's, there's lots of wonderful life experiences, and those perspectives, those narratives are so essential for us to, and it kind of goes back to the history also. We need to learn history so we don't repeat it many times. But yeah, I'm gonna turn it over to Francis, who I know is has a plethora of more knowledge to share in this field.
Thank you so much, Jose, and thank you so much, Alex, for it's such a privilege and it's such an honor to be here. I really am struck by the word Pono, right? I have roots in Hawaii, and when we think of the word Pono, we think about balance and harmony. And I think part of the ways, if you look at the word trauma and the way I frame trauma as a psychotherapist, I think as a social worker, is about powerlessness. And, one way we can deal with trauma is about how do we kind of find that mindfulness and how do we kind of find that harmony. So I'm glad that we were able to have this space to have these conversations. I'm having, some roots in Hawaii. There's such a power in talking story. And there's such a power in being able to, speak our truth and speak our authenticity, especially, given the history of Hawaii being, colonized by force and being on indigenous land, and really the impact that that's had, right, historically on, I think, the Native Hawaiian, the Native Kanaka population. And I think being really about how do we frame these really important questions like intergenerational trauma. Because I think if we look globally in the world, there's so many things happening right now in terms of what's happening in Palestine, what's happening in the Congo, what's happening in these different places, and how these events have been happening historically. And the way I think, specifically, I think the way I look at intergenerational trauma as a therapist is that in many levels, one level, it's collective, right? And a collective event can really have impact or trauma in a population. A collective event like a forced colonization of a land, like what happened to Hawaii back in 1899 with Queen Liliuokalani, right? And how that really affected the Native Hawaiian population in terms of really the right to self-sovereignty. It also could be something like the Vietnam War. It could be something like the bombing of Hiroshima that I know that Jose did a wonderful talk with about a couple days ago. So I think those like really critical events, right, in terms of how it affected the Asian Pacific Islander diaspora and how it really affected people. And the way also I think how trauma really affects the way we look at the world. It really affects the way that we hold emotions, the way we interact with each other. As a psychotherapist, one thing I've learned working with a diverse population is that children will always recreate the emotions they felt as a child. And if a child is not able to kind of work on their authenticity or work on kind of their healing, they're going to repeat those emotions, sometimes negative, sometimes positive, in the way they kind of view anger or internalize, let's say, like sexism or homophobia, all these different things. So I think I'm so glad that we're having these conversations to see the impact society has on families and communities, how we can kind of break that down and how we can heal. And of course, we're going to talk about it more, but I really appreciate this opportunity. Thank you.
Thank you both for that introduction and sort of just kind of laying out the framework of, not only what event is about, but obviously what a lot of, you, your work is about at the core, Francis. And, something I found really interesting that you said, Jose, is that we always have to have these conversations. It doesn't matter what age you are, like it doesn't matter what status you are. It's so important. And then to kind of bring it back to Francis saying that, like, the children, they listen to their parents, they listen to their aunties, they listen to their uncle, and that's the kind of rhetoric or belief system or whatever it's going to be repeated. But it's so beautiful if we can sort of consider all of these factors as truth and always continue to educate people, because that's really what needs to happen is just continuing the conversation and continuing shared experiences. And so yeah, I'm just so thankful that you're both here today, because yeah, this is very on par with what Love Pono does. And thank you so much, Francis, for addressing our name. And it really is obviously a core part of you know why we do what we do. It is really important to us. So thank you very much. Francis, could you tell us a little bit about how mental health plays a role in addressing intergenerational trauma, and what kind of specificities seem to recur or be involved within the Asian American and Pacific Islander community?
Thank you for that question. I think, as a clinician and also as a consumer of mental health services, right? I think being able to take a step back, and if we really look at ourselves, or if we look at, all our positive, right, attributes, but also the attributes that we find that we want to strengthen, is that sometimes that when you see our wounds did not start from us. A lot of times emotions and a lot of times are carried down or passed down. Like sometimes, when I work with a patient or I work with when I have these conversations, I always ask, like, how were emotions passed down when you were a child? How is emotions like anger, sadness, depression, jealousy, but also happiness and joy? How is it passed down? How does culture play a role, right? Because I think a lot of times if great grandma or great grandpa went through something traumatic, let's say like forced immigration or colonization, or the bombing of Hiroshima, right? Or the partition of India, or like the unlawful presence of militarization in the Pacific Islands, right? Like if they went through something like that and they've had a sense of powerlessness, how did they internalize that? And how did they how did that affect the family in terms of like all these different things, right? In terms of feeling powerlessness. And I think by continuing to have these conversations, and it kind of helps deconstruct this idea that not a lot of things are concrete, and that we can able kind of break things down and have safety and have conversations. Because I think being able to know that our wounds did not come from us, and also knowing too that, in a world where there's a lot of like privilege and power, there's a lot of also people who are suffering. And I know that in a cultural power, right, the people who suffer the most are the ones who are silenced. And I think being able to give agency and to give voice and to have like a avenue or a safe space for us to talk about things like trauma, and not to have a stigma attached to it. I think the way I define trauma too is like it's a powerlessness event, right? And there's different levels of it. So it's not just something, it may not be something as big as any time in our life when we felt powerlessness. And I think also like being able to like just really see how we can kind of work with that power, and also knowing like how we can kind of relearn the messaging that we learned in terms of wounds, and how we can also know that each person's going to have a different reaction in terms of how they work interpersonally with other people. And I think also looking at, if we look at the Asian American Pacific community, they're so diverse, right? Asia starts from Palestine, right? And it ends all the way to, let's say, China, right? I'm not good in geography. And then you have the Pacific Islands, you have Tahiti. It comes from, I remember, like Micronesia, Melanesia, and Polynesia, right? And I think like there's like thousands upon thousands of different cultures and experiences and all these different things. And I think we have to keep that in mind when we talk about mental health, because I think mental health, I think the struggle with mental health in this country tends to come from a very like a very white supremacist kind of lens. And a lot of times we have to decolonize mental health and decolonize how mental health is practiced, because sometimes the terms, like, a lot of people of color are misdiagnosed, because a lot of things that for example, like my grandmother, right? She would talk to our ancestors, but I think if someone who did not have that cultural lens would think she would be schizophrenic, but she's not, right? But I think it's really about really practicing that cultural humility, what we're going to talk about later, and also knowing like how can we make people feel safe? How can we make people feel that they are listened to? Because also thinking about words like trauma and suicide, right? Because I think if we really look at suicide, sometimes I think our healthcare system is so crisis driven, and it's so based on like not intervention, but it's so capitalist that it doesn't really talk about ways we can hold safety and space, especially for marginalized communities, because already like we have to think about like the countries people come from and how healthcare was in those countries, if they had the privilege of healthcare, or if they had the privilege to talk about different things like their mental health, or even had the safety. Because if my great grandparents were surviving, right, their whole lives and surviving war, they wouldn't have the capacity, the freedom, or the privilege to kind of take a deep breath and have talk to someone else, you know? So it's about really having that perspective, and also having the resources like what both of you offer to your prospective communities. I think that's important as well.
Thank you for that answer. I can't help but think, obviously we're talking about intergenerational in general, but just generational differences of how we view mental health as well. I mean, obviously you look at, Gen Z millennial, they're going to be more likely to kind of, seek therapy or seek mental health resources, but they're going to have a very different perspective from, say, their grandmother who, to your example, could have thought, would be diagnosed completely incorrectly just because of a cultural practice. So, I mean, I think that's such an interesting part of the conversation that is so specific, and really, really appreciate you, sharing that perspective. Um, I know you kind of already hit it a little bit, but could you maybe address any like common challenges that are faced, by the Asian American and Pacific Islander individuals who are seeking mental health support? Maybe similar to sort of what I just alluded to, but I mean, expanding upon that perhaps. And what have you seen?
No, I think there's so much strength that lies in diversity, but I think bec the challenge too in diversity is having trained clinicians, right? Having trained clinicians who practice cultural humility. I think that has been a challenge, I think, in terms of managing or having really culturally appropriate services out there for mental health. I think also having providers that look like us. I think it's great to have allies. I think that's a wonderful thing. But I think also at the same time to have providers who have lived experience and look like us and are able to say like, I know what it is to go through what you've been through. I think barriers too is I think money and finances. I think, when you have like privilege and people not of color, right? In the government, making decisions for a majority of people who represent the diversity of the United States.
So many, so
Yeah,
off.
yeah, yeah. So I think that is it too, right? And I think also not being able to have these conversations. I think a lot of things are fear driven. I think if you look at the last 2 years and the rise of anti-trans, right? Anti-trans legislation and anti-trans laws against our LGBTQI trans youth. And that has relate to a lot with not just internalized, I think, misogyny or sexism, but has a lot to do also with people being afraid of, due to religion or due to all these different things, but not like people are scared to have these conversations. So I think it's about really creating safe spaces to talk about these things and not being afraid to have these conversations, but also allowing, I think, community members to be empowered. I think a lot of things happen that have not been addressed. And also, if you look at the United States by itself, right, we were founded on genocide and enslaved people. And I think we never really have that ability to really address it or talk about it. So I think being able to have these hard conversations also and talk about how the effect, I think that's why I think it's so great that there are things like the Peace Collective and the Pono, right? Because you're able to have these conversations about, like you say, the militarization of the Pacific Islands, or the effects of the bombing of Hiroshima, or domestic violence and how it affects like the AAPI community, Asian American Pacific Islander community, because a lot of times what the core of it is trauma, right? The core of it is powerlessness. The core of it is not having control. And I think one of the things I learned as someone who's not only experienced trauma, but someone who's as a trauma-informed therapist, is that what trauma comes down to is about of powerlessness, but also a fear of not being one with oneself, right? And a fear of like always wanting to have control over something. And I think being able to let go of that control too, and know that we don't have to be perfect, but we can be loved, and all these different things I think are so important. So I think there, even though there are challenges, I think I choose to look at it like as a dialectic, without pain, there's impossibility, right? And I think things are a lot better now than when I started as a clinician 20 years ago. I think things are a lot better now. Things can be, of course, be improved, but the fact that, for example, like what's happening in Palestine, right? Like 20 years ago when I started doing pro-Palestinian work, I was seen as like anti-Semitic. But now I think like the work has shifted and they're seeing the importance of indigenous rights, right? And anti-imperialism and people who want the rights of Palestinians to be respected. It's not anti-Semitic, but anti-Zionist. And addressing the intergenerational trauma and the impact it has on Palestinians in Palestine, right? And talking about how it's been effective for generations, because I think people forget too that like, the thing with trauma is that, we could break something right away. We could break a piece of glass, we could break something right away, but to fix something could take generations, and I think that's why it's so important to have these conversations because, I think once we heal, the biggest gift we can give someone else is a healed self, like boundaries and all these different things.
That was great. What a comprehensive review and answer. I really appreciate that and really appreciate your work that you've been doing for 20 years with the Free Palestine movement. That's exceptional and sort of addresses just the notion of it. I'm sure some folks, and I know some folks they didn't know that was a thing 20 years ago. Now it's on this global scale, this global conversation, and that's so lovely. But it just shows you the power of, some would say smaller groups or smaller voices. It just shows you the power when people really actually collectively come together and say, hey, something's got to give, something's got to change. But, wouldn't that be nice if, the old white men in office could do the same thing? So it's just, it's a, age-old conflict. But I think that's why it's so important that, we're each in our kind of respective roles and just trying to do our part. And as you said, being that safe space so other things are possible. I really appreciate that. Okay, turning it over to Jose for a minute. How do you think our various programs that we're a part of, me with Love Pono and you with the conflict and peace specialists, how can they address the stigmas that are surrounding mental health in any community?
No, thank you. I mean, I think part of it is, I mean, a big portion of the work that I do is around, and I think the work that you're doing is around getting folks to start shifting their perspective, shifting the conversations that they're having, that just because they're, you know, what you hear in the media or what because that is unfortunately what clouds us many times, as we're our daily routine. I always love visualization, kind of simulations with folks, and during whether I do workshops or I'm whatever the situation may be, talking story, it's we're busy. We're always doing, we have things to do throughout our day. Rarely do we take time to pause and think about, like, is this the best way that we're doing this? Is this the most effective and the most healthy way, not only to myself, but also my loved ones and overall my community? And if it's not, then how can we shift? And we are human beings that are so bent on like routine, uh, and there's comfort in that. But unfortunately, with that, and then we become very specialized in different areas, which is wonderful. But the other side of that is that it creates, tunnel vision and silos, and we get away from the idea of collaboration many times. So I'm constantly having to reassess my own perspective and having to think about, like, oh, how exactly, I can't just do this the way I've been doing it. I have to, even if it's like some programming that I do, I try to change the location because just there will be different people that come by. They'll introduce people to other places, and be comfortable with the fact that, going back to a little earlier about dialogue and providing that space for people to speak. Yes, we're constantly modeling to our youth, but we should also provide a space for our youth to share their voice. There's so much that we can learn from them, so much that unfortunately, because we've been inundated with so many years on this planet that we may have forgotten. We may have known at one point, how to practice simple care and kindness toward each other, but we forget about that. When we see our youth like taking care of a small animal or like an ant, and you're like, it's an ant, or care for anything, whether it's living or not, have I think there's a lot that we can learn from each other, and being okay with being, well, want to call it like called out, or being and I'll share something, like initially the program was going to be called AAPI, and someone in our community reached out and was like, I would really appreciate if you said the whole name, specifically Pacific Islander, because it's unfortunate that our whole community has been resorted to two initials, two letters. And yeah, like definitely it made sense. And what I love about it is I shared it with you, I shared it with Francis, and it was like no brainer. Yeah, of course. And that's what I love about, this community that we're building here. Um, Even though we haven't known each other for long, I feel as though, if you believe in, reincarnation or whatever your spirituality may be, it's like, yeah, I get it. It's what's right, and kind of going back to the Pono talk, and it just reminded me of, sometimes in presentations, I always try to talk to people like, so are you trying to figure out, what's right or who's right? Because if you're trying to figure out who's right, that's more of an argument. But if you're trying to figure out what's actually right for the whole community as a whole, you know, that is a discussion. And that's what we're trying to lean toward. How can we have more dialogue discussions toward each other? And, Pono being, a balance, being about what's right really for the community and everyone involved in it. So, yeah, I mean, violence prevention, definitely. What I love doing is, because I also teach at times, and when I get like social workers in my class, I'm like, well, you're the experts in your field. I do not know the social work field, but you let me know the services that are being provided to you right now. Are they working? Are they not? And if they're not, what would be something better? Think outside the box. Just because it's there, it doesn't mean that, you know, there's what I've learned is that there is no cookie cutter band-aid to resolve all our conflicts, all our issues. We're multi-layered human beings. Even within the same culture, you can't be like, oh, everybody in like this community, we need to approach it this way. No, it's like everyone's an individual. And that's really what it's about. I mean, that's the whole reason we have different names, the whole reason we have different lived experiences. Um, so just trying to not rush it and take that pause to kind of uh listen to people. It's so powerful because I've found, and it's unfortunate, I found people that are older, more than mid professionals, and they've never had anyone practice active listening with them, and that breaks my heart. Just because as I learn about their lived experience, I realize, oh, okay, I see. They have always been in an environment where they were told what to do, and and we're just okay. And that's the way they function. Rarely were there opportunities for them to use some critical thinking, think outside the box. So, but yeah, I think I never look at, and some folks also ask like, oh, there's another peace program. Is it like competition? I'm like, no, all the better. Like that's amazing. Like,
Yeah,
if
that wouldn't
people,
make sense.
yeah, like I mean, I look at Live Pono, Love Pono as a peace building program, it without using the terminology, which is even better because
No,
then you're approaching
100%. Yeah.
folks through different angles. Francis is doing the same thing through some of the work that he's doing as well. Everyone's doing their role. It's just a matter of providing that lens, really.
Well, it's interesting that you say that because I mean, I feel like the folks we were just sort of talking about who, they're not willing to sort of learn outside of their comfort zone or really kind of put themselves out or want to learn or want to be called out. I mean, I don't think that's the wrong terminology, called out. I think that's okay. And then I think like if you get called out, like you turn it into, okay, is this a moment to like somehow like actually learn something? Like not just have an argument, like you said, have a real discussion. I love how you pointed out, if you're thinking, oh, like, I want to win at the end of this, like that's not a discussion. And so, that's just those are the same, kinds of folks who, aren't gonna want to, they're the same ones who, when they hear two peace programs, are going to think, oh, clearly they're combating each other, right? But that's not how we're functioning here. We're on a different sort of level where we're trying to have everybody included and make sure that their specific role on this earth, or however long it may be, is giving back the way that we want to. So I just think that's really great, and I really, appreciate all the work that you do. And sort of just in general, having this conversation about how people do need to sort of maybe not consider just their experience when they're working with anybody in general. Like, you're not going to be able to put yourself in somebody's shoes directly, obviously, but even that, realizing that, saying, okay, there's no way I can know what's going on with them right now. So sort of on that subject, Francis, could you try and kind of describe how cultural humility influences the effectiveness of mental health support for the Asian American and Pacific Islander individuals?
Yeah, no, I think that's a really important question. We talked about the diversity within the Asian American and Pacific Islander community, right? And I think also to know within that diversity, there's so many different individualized lived experience. And I work at one of my other jobs. I work at Stanford, and I was a co-chair of the Diversity, Inclusion, and Cultural Equity Committee. And what we did for about 3 or 4 years is that we wanted to shift from a cultural competency to a cultural humility perspective. And the reason why we wanted to do that is that, the difference between cultural competency versus cultural humility is that, in cultural competency, someone can learn about the different cultures, but then the complexity of that is that makes them the expert. But the beauty about cultural humility, right, is that it reverts the power dynamic. I think a lot of times we have to remember, as medical professionals, right, as mental health providers, there is a power dynamic there. And I think also the knowledge too is that a lot of people of color historically have been mistreated within the healthcare system. I mean, I think if you look at, let's say, with the African American community and the history of enslavement in this country, right? There was Tuskegee, or there was Lax, the woman Lax. Like, there's a lot of like horrible things that happen in terms of just looking at brown and black people as just bodies, right? And really also how were people of color seen in the healthcare system in terms of experiencing their own like experience of not being heard and not being validated. And I think, I also used to, I worked in Hawaii for 3 years, and I worked in Waianae, and I saw that firsthand. It's like I saw the difference between how Native Hawaiian people were mistreated and had the raw end of the unfortunately did not get the same resources as people who were not Native Hawaiian. And I think it speaks to the importance of cultural humility, because each and every one of the people that we work with are going to have different lived experience. Like, someone's going to react differently individually to trauma. Someone's going to react differently to an event. And we have to ask them what their perspective is. I mean, not we have to ask, but we want to challenge ourselves to give grace and learn what their perspective is and listen to what their perspective is, because I think by that, then it allows us to hear the whole story. I think a lot of times as healthcare providers, there seems to be a challenge in terms of wanting to fix or this white saviorism. But I think at the same time, we have to take a step back and go, what can we do to listen? What can we do to build skills? What can we do to hold space in a very safe way? And the beauty with cultural humility is that, we understand it from an individual perspective. And also there's such thing as individual versus family. Like, someone can be a different person individually, but within a family it could be different as well. And also you can take like 5 people of the same ethnicity, but they're all going to have different experiences based on class, based on gender, based on sexual orientation, right? Based on a trauma or non-lived trauma, based on access. And that's going to shape the way they view the world. And we have to understand that. Like just because they may share a similar cultural trait, like eating the same cuisine, doesn't mean they're gonna have the shared emotional responses when it comes to reacting to an emotional event. And I think that's why it's so important to practice cultural humility, is because it allows us to learn from the patients we work with, and allows us also to learn more about ourselves, because I've been a provider for about 20 years, right? And I think I'm constantly learning every day about how to do better. How to do better in terms of how to hold space better, how to do better in terms of how to listen, how to do better in terms of what is safety, how to challenge myself. And I think that humility piece is so important, especially when you work with such a diverse group of people, because Jose brought up a point, right? Like, you have a lot of our aunties and uncles who've never been listened to, who've never been able to feel like they were validated. And I think there's such an important power of listening. And I think that has a lot to do with the historical aspects of intergenerational trauma, right? That has a lot to do with just really how, like, if you look at trauma, discrimination, and stigma, right, that affects people how they feel, that affects anxiety, that affects also people in terms of distrust of institutions. I mean, if you look at, like the Japanese internment, right? Or you look at the stolen land of Native Hawaiians, like, if people go through time and time again historical distrust from government, they're not going to trust the institutions, and healthcare is an institution. I mean, we have to acknowledge that also. So is education, right? So all these different things. So how can we kind of break that trust, and also knowing too that race-based stress exists, like, as a hypervigilance exists, as a brown man, as a gay man, right? As someone who, like, I tense up more when I see police. I tense up more when I see people who don't make me feel safe, right? Because of, or all these different things, because of the reality of the world and how it works and the shifting power dynamics. So also acknowledge that race-based stress does exist, right? And they provide negative mental health outcomes like racism, oppression, police violence, the genocide. Like, all these things are happening, that is existing, but there has to also be systems in place that exist too, that allow us to have safety, that allow us to feel safe and talk about these things, that practice cultural humility. So we're able to, what Jose said, be heard, right? We're able to be listened to, and then see what interventions are available to us.
No, you're totally correct. I mean, these conversations can be had all day, but if the people who actually have, the privilege that is, the root cause of the oppression aren't listening at all, then, it's there, there's no way to, there's no way, obviously there's no way to eliminate the privilege in the slightest, but there's no way to, actually realize it exists and use it to the experience of yourself and put yourself outside of it for a moment and try to get some things done that maybe wouldn't just affect and help them. But such an interesting definition difference between competency and humility. I really appreciate that there was a distinction put on that, because there is such a sort of like colonial undertone to competency. Like, I'm going to understand this to its entirety, and there's no way to object because I'm completely competent on it. I mean, it really just takes away from the fact of what is trying to be done anyway. So humility is just a much better term. So I really appreciate that. And also thanks for mentioning about the African American experience as well. We've done a similar podcast on intergenerational trauma in the Black community, and it's so alarming, the birth rate, the mortality birth rate for Black women, 3 times as much as white women. So it's these truths, these facts, like, these are things that, again, people who aren't willing to have this conversation, who have the privilege to be able to ignore these conversations because it's not, happening in their actual bubble. These are the things that people actually need to learn about in order to, get the right conversations going. So really appreciate you mentioning all of that. It was quite prolific. So thank you. Jose, could you discuss kind of the intersectionality between just work and education about intergenerational trauma, violence prevention efforts, which is obviously core what we do at Love Pono, but as well as the work that you do as the conflict and peace specialist at Manoa, just making sure that people actually do the work and stay educated. I mean, how important is that? I mean, I obviously know it's super important, but like, but I mean, it it has to just be in our minds at all times because there are so many people who do object to it rather. So, tell me your experience with that.
No, thank you. What I, what I love about today's talk is how much we're using the word trauma. It's like a taboo word, especially in the workplace, because first thing sometimes that comes to mind is like, oh, is there liability? Oh, do we need to get like a trained physician? And it's just there's a lot of unspokenness. I think in the previous conversation we had, I talked about how the COVID-19 global pandemic is a collective trauma that we've all gone through, that we still continue to go through. It hasn't gone away. It's just that you don't hear the reports as much, but people are still dying. There's still people who refuse to get vaccinated. And in general, it's becoming going to be like an annual thing that we get like the flu shot because it keeps evolving. Uh, but it was like a good 3, 4 years now. And um, the mindset was like, let's get back to normal. Rarely were there spaces provided to like just check in on people. How are you doing? It's like, oh, are you ready to, get those reports or start working again? It was little acknowledgement about, how many people lost how many loved ones during this. That's powerful. I mean, I know in my own experience, from time to time, yeah, people get older, people come down with certain sicknesses and they pass away. That's without even touching upon suicide, a whole nother realm. Uh, but it was like 10, 20 times full during the pandemic. And I have yet to be provided an opportunity to sit around the room and have conversation about this with anybody. So you talk about work, education, even in the classroom, rarely have folks been able to have those opportunities. I'm hoping there are, educators out there that have provided those opportunities. I try to be an eternal optimist and I hope that there are also employers that have provided that opportunities for their employees. But I don't think that's the majority. I mean, you look at leadership, you look at what's on the news, rarely do you hear the word trauma because people are just, a lot of it's fear. People are afraid to acknowledge the fear. That's goes along with it.
Definitely. Definitely.
It's
It's an acknowledgement. If they're afraid to acknowledge it, it becomes way more real.
yeah, yeah. I mean, right now what we're talking about is real core emotions. And you don't find that in the workplace. You don't find that in education. It's I'm not saying it doesn't exist. There are pockets here or there, but for the most part, it's not there. And hopefully, I'm hoping, when we talk about intergenerational trauma now, uh, we're just focusing on the households, the family members, the generations. We're not even talking about the generations of people working or, because, we school education is not, a university campus, just because a person's considered an undergrad, they're not your typical all the time 18 to 21, 22-year old. We have folks, we have this terminology, non-traditional students, folks who are in their 30s, 40s, 50s, people coming back to school in their 60s, 70s. So there's many generations there. There's a trauma that's unspoken there as well. But we're just focusing on the families and we're hoping that the families are equipped, and many times they're not, to have these conversations. But hopefully, I eternal optimist, there's love and there's patience. And so for anyone listening, I would say if you want to have those conversations, starts with, yeah, approach your loved ones. I think if anything, hopefully they will be able to provide the time and the space to have those conversations, even if it is uncomfortable. Because I think that's really the beauty of it. When we push ourselves outside our comfort zones, there's wonderful opportunities to grow from that. You know, we were going to, you know, shifting a little to violence prevention. I don't use that terminology. I talk about like taking proactive steps. How can we shift the conversation? How can we talked a little bit about that? I talk about also take a step back. What's the culture that's nurturing this? We're always on the go. And maybe that is the intergenerational trauma. Maybe it is business as usual. Maybe it is that, there's different stats and learning objectives that need to get done. There's assessment, whatever it may be. But just taking the time to pause and reassess. Uh, so that's, I think, the intersectionality is that we're not talking about it, but we are today. So thank you. And thank you for just, this opportunity to continue to have these conversations. And I am bringing more folks into the dialogue of it all.
Definitely. No, that's our goal is to is to really I really like how, I'm going to bring it back to what Francis said a few answers ago. We all sort of have our place, but with this collective place, or with our individual place rather, we can make it such a collective and safe space for others, or just allowing this opportunities. So everyone's got to do their part though, right? I mean, it's just so important. Yeah, and yeah, I was the whole time when you were talking about COVID, I'm just like, yep, yep. Like I'm just thinking like, yes, yes, because people like it is, I think it's a fear. I think that and this probably goes with any trauma, of course, but just making it really broad, obviously, and speaking of the collective trauma that some may not be willing to accept, that was this global pandemic that is still affecting us today. Having this sort of, I mean, I would call it a somewhat of a denial, but a lot of people, yes, wanted to get back into normalcy, whatever that may be. And even folks who, yes, like they obviously had a horrible experience, or maybe a lot of family members passed away, and during those few months of kind of, I would say maybe 3 to 6 months of kind of like grace, that like people actually were thinking and caring about that. But then once things opened back up, it almost became a stigma to worry about anymore, to talk about it anymore. Oh, don't talk about that. We've moved past it. Things are open again. Like, yes, coronavirus was horrible, but things are open now. Like we can't really talk about that. And I'm sure that kind of happens with all trauma. Yeah, I know it happens in regards to violence prevention and domestic violence. I've seen it firsthand. People don't want to talk about things that make them uncomfortable. People don't want to talk about things that um, really it force them to think outside of the one way of thought that they've always thought. It's comfortable there, right? It's comfortable to think that this is how it happens, A, B, C, but it isn't. Like, everyone's experience is different, but we can learn from each other if we start to sort of think like that and start having conversations like this. So yeah, no, I just continue to just sing both your praises, and I'm just so excited that we're having this conversation because I do think it's so important. um so Francis, to bring it back to you, what strategies, because we're pointing positive, what strategies have you found effective that for breaking down systems of oppression that contribute to intergenerational trauma specifically?
Um, you know, I think by looking at trauma, right? The way looking at trauma, the way I look at trauma, like international trauma, how it affects like in like 4 levels. I think governmental, individual, community, and family. I think that's one way to look at it, because then we could kind of see how, because if trauma affects us in like these different layers in different ways, and each one's going to have its unique response. I think another thing too is really talking and acknowledging the stigma that exists. I mean, you two talked about it just a few seconds ago, but there's a lot of stigma that exists with, you know, things such as like mental health or suicide or trauma or violence. And I think a lot of it has to do with like, I think the way we are cultured in this nation, the way we're cultured towards either not necessarily purity, but I think we're cultured towards like not necessarily whiteness either, but I think we're cultured towards like having control. Right? We need to have control over a lot of things and we don't want to talk about it. But I think a lot of it is that I think also a lot of us are not trained to sit in uncomfortability, and we're not trained to sit in just the moment. I think that's it too. I mean, as you were talking about COVID, I'm older than both of you by probably 20 years, I think. And I think about HIV AIDS and how it really impacted my generation, and I lost like partners and friends, and that was kind of a different kind of pandemic and COVID that still exists, right? And I think that was really an intergenerational trauma moment for all communities who were queer or who were affected by the HIV virus, right? And how like especially the queer community who belong there, who came from there, like there's a different, because I have my private practice, and they really have a different effect in terms of how they view themselves and sex positivity and body positivity and how they interact with other people interpersonally as other queer men who were born after the HIV/AIDS pandemic. And I think it's something to think about too, because it really looks at about how a collective trauma like COVID or a collective trauma like Palestine or a collective trauma like HIV, right, can really affect a community and how it could really impact the way we interact each other and hold each other and kind of deal with each other and feel like, do we have value? Like, are we enough? Do we deserve to be in this world? I am constantly reminded by, when people are affected by trauma, a lot of things they experience is like, is my pain real? Is my pain valid? Or will people actually listen to me? Or will people hold space for me? And I think a lot of times too is that when people go through pain, is sometimes they already come from a system of pain and a system of oppression. And it's about really just taking time as friends, as community members, as mental health providers to listen, right? But also having the humility to know what we can and cannot do. And the importance also to know that we're not here. Like I know in my private practice, like I'm not here to be a savior. Like I give all the glory to my patients in terms of their healing. I'm just here just to listen and to really hold space. Because I think everyone has the tools, but due to trauma, due to all these different things, the tools were stunted a little bit. Like I'm living proof of it, but being able to also be open also about what we've been through. I mean, it's not about holding on to your trauma, right? It's not about, but it's about also using pain as an example, like being open to say, okay, I went through this, I went through that. Sometimes with my patients, I'll share a clinical example of what I've been through. And the reason why I share it is because I want them to know that there is possibility, right? There is possibility in a lot of things. And I think also when we don't see representation, right? We don't see representation in terms of, oh, this person grew up working class, or this person grew up this, or this person was disowned, or this person has this, right? But they were able to make it, and I think that's important too, is that like having that example, I think is so important too, because, the one thing I learned with trauma is that the opposite of trauma is always going to be connection. And I think it's how we connect to other people. And that could be step by step by step, right? It could be how we connect to each other, how we connect to one or two people in our lives. And I think that's important too. It's about that. So I think it's about those different things as well. And it's about also how we, in Hawaii, malama, right? How we malama ourselves. How do we take care of ourselves? How do we, give peace to ourselves, and how do we practice all that self-care? Because I think self-care is important, but also self-care is painful. Healing is painful. I mean, one of my heroes is James Baldwin. He's always been one of my heroes. And he has a quote that I'm probably going to butcher, but it's something about, I think he says something like, the reason why, and it goes to what to YouTube were saying, that the reason why a lot of people don't like dealing with their pain is that they're forced to heal. And a lot of people, healing is very hard. It's very, very hard. I think it's very hard because it allows us to really rethink our family dynamics, it allows us to rethink our place in our lives, and allows us to really choose boundaries and kind of see like what is healthier for us. So I think it is a very, and healing also is very fluid. There's no like one way to do it, you know, and I think that's important to think about as well. And to give ourselves grace in the process, right? Not judge ourselves.
Well, thank you for that answer. And, shout out to the great late James Baldwin. I'm actually reading Giovanni's Room right now. So, which is, I mean, a little maybe, you know, darker, maybe not as many inspiring quotes out of that, but, definitely dealing with trauma for sure. I'm a huge fan of his work. So really, really appreciate that. You know, there is so much power in sharing. I see that here with Love Pono, and in our podcast, and a lot of folks, we talk about things that sometimes people say you shouldn't talk about that, or that we don't talk about that. That's not dinner conversation, like, and so I think that's, I really appreciate you saying that, because I don't think people are keeping that in mind when they do have this block to it, like, oh, why do you have to speak about that? Or it can go through so many things. Why do you have to speak about your trauma? Why do you have to speak about sobriety? Why do you speak about you're queer? We don't want to know. Why do you want to tell everyone you're trans? I mean, because they're living in this world where people in and so many folks were oppressed and colonized all around them, that it's just provided this normalcy blanket of like, this is not the discussion we're going to talk about, because that that's complaining, or that's not going with the norm, or that's not moving forward. And in reality, it's just, killing a lot of people, in more ways than one, right? So it's just it's more important than ever to have those conversations, that people are saying, shh, we don't talk about that, because we're seeing what happens. We're seeing what happens in our communities. We're seeing what happens in the news. We're seeing what happens when you do ignore and cover up these really important things that have been happening for a long time, and you really just accept them as the norm. It's just wrong. It's really sad. But I mean, I to point it positively, I wrote down what you said: the opposite of trauma is connection. I think that's so beautiful. I hear that, and the first thing I think is, of course, and even just connecting within yourself, because when you are dealing with your trauma, you're placing yourself. I know personally, it can feel like you don't know which direction is the right direction or possible. Everything seems so lost, right? So the opposite of that would be, tethering that connection to yourself, to your heart, to your soul, whatever you want to call it. And, as well as the community and the people around you, and sort of, making them a part of your healing, and not just, maybe going back to folks who are the opposite of, your healing, are part of that trauma, but really sort of finding that core group. But yeah, I think it starts within yourself always. So I think it's so really inspiring. So I really, really appreciate that. So just one kind of last question before we wrap it up for Jose. How do you think community members and mental health providers can work together to create, safe and inclusive spaces for addressing these issues like intergenerational trauma, in the Asian American and Pacific Islander community, and just, keeping these conversations going? Like, what are some examples of safe and inclusive spaces? Obviously, besides us, I mean, obviously, we're anybody can come to us, but what have you seen, and what have been the results of what you found?
No, thank you. So one thing that I just before we even get deep down the rabbit hole, so one thing that was brought to my attention this past semester, so part of me shifting my own perspective was not using safe spaces, because the reality is that safe spaces don't really exist. At best case scenario, we can create brave spaces.
Oh, I
Brave,
love
we can
that.
create spaces where folks can feel brave enough to share, to be comfortable with you. Um, and I use that just because I think we don't know where people are coming from. We don't know, as skilled as we may be, we don't know everything. And so yeah, going back to community members, mental health providers, uh, we never know what's the tool in the toolkit, or what skill sets is it that we'll need. But not to be repetitive about dialogue and active listening, but sometimes it's like common sense, I feel like, but it's
Mm.
not, unfortunately. And that's why we
Yes.
keep having these issues.
Yeah.
That if we were just to listen to the community, to the people, actually, to the people themselves, to the person themselves, the individual, what exactly is it that they need, then we could be a little better at providing those resources. Once more, there's no band-aid, there's no, even these terms of like Asian American, Pacific Islander, it's the census. It's easier to encompass large countries, people of different ethnic backgrounds, into just these terminologies, just to make it easier for the census. I mean,
Mhm.
as someone who is Peruvian, um, having to be referred to as Latin American or Latino, or Latinx, like, yeah, it's more terminology. It's getting away from, and anyone knows the history of Peru, or just like, it's a large country. There's multiple, you know, various aspects and lived experiences that people have. So it is, yeah, but that's complicated for people. It's like trauma, it's complicated, it's uncomfortable. So getting to nitty-grittiness of it, is what's bothersome for the general folks. And so I think, just folks getting to know people, getting the community to know their neighbor. I mean, I think that's one of the beautiful things that I've found here in Hawaii. It's that, community experience, the extended family, the fact that it's not just you and your household, and it's, no, you have your neighbors, you have the aunties and uncles that are not blood related, and the cousins that are not blood related, but everyone's looking out for each other. Everyone's like, oh, it's been beautiful just to get that care and kindness in so many different ways, from shifting to being a parent, and the generosity of, acquaintances who became wonderful friends, um, people dropping off food, just little things that you don't didn't think you needed. And so just that consideration, I think, is so key. And so I think if we were to, um it's also looking at the culture, how do we approach it? Like, I remember visiting Japan for the first time, and one of the first things I was like, where are all the houseless people? How come there aren't any houseless people out here? And as it was explained to me, um, there's such a deep, you know, um, connection of responsibility,
Mm.
that even if it is that uncle that is so far removed, they are blood, and we need to do something so they're not out on the streets. Um, I mean, I know it goes along with like parts of shame, and that, that's the other
Mm.
part of the culture, but I think about how coming to Hawaii for the first time, there were so many things that I was blindfolded. I had my blindfolds on, having just, my only impressions of Hawaii was the media, and the media does not do the best job to ignore, not even the stories of the overthrow. Uh, I mean, I think they're getting a little better nowadays, but a couple decades ago, not that much. I know Francis talked about feeling a little older, but Francis, I don't think that we're that far in age, actually.
I am one of those older students that was
Yeah.
mentioned earlier.
So, thank you for your kindness.
But I do
But
understand,
yeah.
why you said in reference to the question, or to the subject rather, because I mean, yeah, there's so many folks, and obviously this is getting slightly off subject, but as on a broad scale, so many folks, within the queer community that, didn't experience the HIV, crisis and AIDS epidemic. Um, like folks in the 80s and 90s did. So it's a disconnect that we find with our own community, which we talked about with certain Asian American communities too. I mean, not everyone's going to have the same experience, right? So that's why these conversations are so important. So thank you. So I didn't mean to cut you off, Jose.
No, no, no. You hit it right on the mark. Thank you. But yeah, it kind of goes back to just, being aware knowledge, learn history, continue to have those conversations. And we talk about mental health providers, but I think sometimes, going back to Francis talking about connection, anyone can do that. You don't have to be a licensed mental health provider to build connection with people. You could do it everyone's doing it at different stages, ages of their lives, and that's the beauty of it. You never know how that simple act of kindness could go such a long way.
No,
From like someone just needs help putting their groceries in their car, or
someone needs to be said good morning to.
yeah,
It could be as
yeah,
little as
just
that, Yeah.
acknowledge. Yeah, just acknowledge. You
Acknowledged.
never know what people are going through. That's one of the things when I go into a room and I'm doing a workshop or whatever, presenting, I'm try to be conscientious of the terminology I use, and also let folks know that if I have said or triggered anything, please let me know, because I don't know what everyone's lived experiences in here,
Mm-hmm.
and so the best I can do is just share what mine has been and how that has kind of uh, shaped me or prepared me for being here in front of you today.
Well, no, I think to bring it around to what Francis said earlier, sharing is such a powerful thing. It really is at the core root of what all of us do. So it's been so nice, kind of having this really broad conversation, but it's gonna, I know, get people so excited, for the online event on August 23rd. Which again, Jose will be hosting, but Francis will be the special guest, and it's going to be super educational. And yeah, I encourage anybody who's listening who, if maybe this is the first time you've heard a conversation about trauma, especially within the Asian American Pacific Islander community, to not leave it at today. Use this opportunity to go to this event, tell folks about it, incorporate your community, and sort of be a part of the change that I think we all want to see, right? So, I know I'm personally so excited about the event at noon, August 23rd. And in general, as we leave, is there anything, and I'll start with you, Francis, that that you just expect people to take away from it, the event itself, or what you hope they will take away from it? We'll start with Francis, then we'll go to Jose.
I, you know, when I'm given the privilege, right, or when I'm given the space to talk about things like trauma, I'm always aware of my own privilege and my own perspective. But I think one thing that I think a key takeaway is allowing for self-reflection. I think allowing all of us to take a pause and to self-reflect and kind of see how what we hear resonates with us. And even if it doesn't, it's okay. But also acknowledging too that, you know, to that we have the agency and we have the power to shift narratives that were told to us that may have been untrue, right? Narratives about emotions or people, right? Because I think a lot of times, like when when we're living through survival, like we're living in the survival mode, like our lens are going to be strictly, or if we're living in hypervigilance, which a lot of people of color live through, right? I think it is a challenge. And I think being able to take pause and to take breath, and to know that, and to also challenge yourselves to ask for help. I think there's so much, I think, freedom, I think, and so much kind of the self-revolution, right? When we're able to allow ourselves to ask for help, because I think historically, I think we were never allowed help. I think historically, when I think people of color, I think Asian American founders, enslaved people, right? Brown and Black people were never really allowed help. So a lot of times we have to learn to do things on our own. But knowing that there are communities out there that are able to hold safety and space for us, and also allowing ourselves rest. I think that's important too. I think for a lot of people who come from either immigrant communities or come from like ongoing cycles of intergenerational trauma, is that we're never allowed to rest. So I think being able to take a pause and just allowing ourselves to rest, whatever that may be, and also like demystifying the word trauma. I think there is such a stigma with the word trauma, but knowing that trauma comes from different levels, and just because we talk about it doesn't magnify a solution. I think when we talk about something, right, it gives it less power. That allows us to have these like conversations of safety. I think especially when you talk about things like, domestic violence, right, or all these different things that that I think are so important, because then it kind of minimizes the shame, because if you talk about things like suicidal thoughts, right? I think as a provider, I think when we're able to allow safety and allow safety to talk about these things, then allows people to feel like they can ask for help. And I think that's important too, because I think as human beings, I think a lot of us are so scared of being judged. A lot of it can be a cultural lens, it could be a lot of things, but I think having that space of not judging, I think is important too.
Thank you for that. Really appreciate it. Um, Jose, what are you most excited about people taking away from this event? Or, thank you for again for holding this space and and having it be possible for Francis to come in and have this conversation. So when you do these events in general, what is always maybe like something that kind of is interwoven throughout all of them in the sense of like a collective energy response?
I think just the opportunity to move along these pathways, we've all have our different pathways, but being able to collectively come together for this moment and learn from each other, I think that's really what it's all about. I never know who the audience is going to be, and they always bring up some really beautiful questions, and sometimes it pushes us outside our comfort zone, and sometimes yeah, we get the opportunity to grow, going upon just some things that Francis just talked about, and that's really what working off of each other. I love how he brought up privilege. We haven't had the opportunity to talk, but we could have a whole nother many hours
Mhm.
talking about it. But just the fact that we're able to have this conversation is a privilege in itself.
Mm.
Um, I love the conversation about self-reflection. I constantly tell people to practice that, even if you can't journal, like while you're walking, just try to think about what is the village, what are the dominoes in life that brought you here. But along with that, also practicing gratitude, you
Yeah.
know, thanking those folks, whoever they may be. Um, you never know where people are. Uh, Thank you for mentioning taking time to rest. I'm constantly reminding myself for that. But yeah,
Mhm.
we are our own worst enemy, and we talk about intergenerational trauma, and there's a lot of unspoken stuff out there. There's a lot of you observed your parents, your grandparents working hard, and so you're like, well, I'm not going to be lazy. I need to do the
Mhm.
same. Even though, yeah, times are different. They were maybe out in the farms, they were working multiple jobs. You still feel as though you need to be moving at that pace, but just taking time to be kind to yourself, I think, is what's most important. So yeah, no, thank you. And thank you for helping us the opportunity to share this event for it's Friday, August 23rd at 12 p.m. Hawaii time. Folks can register on Eventbrite, they can look it up, or they can go to tinyurl.com / 082324 and find the registration link that way. Also, a copy of, if folks can't attend just because life happens, a copy of the event will be on the Peace Building Initiative's YouTube channel within 24 hours after the event. Yeah, just and what I really love about these talk stories is that I don't know where it's going, but it's been a very good journey so far. And what ends up happening many times is our future speakers are the folks in the audience themselves. So just building those connections again, as Francis kind of referred to. So thank you. Thank you for having us, Alex, and to Love Pono
Yeah,
for
I
having
love
us.
that. Thank you both. And we will have the Eventbrite link posted on this Spotify. So if you are curious about where to go to it, you can click that. And I know that we're going to be shouting out on social media as well. So however you are listening via either Spotify or KTUH, there's many ways to sign up for this program. I know that I will be there, so I'm really super excited. Again, this has been such a really wonderful, robust conversation about so many important things. I keep thinking of things that I wanted also to say, but I think we'll just end it on a high note because it really has been such a pleasure talking to both of you. I mean, just the like you both said, the privilege to even talk about trauma, because some people it's just not in their vocabulary, it's not in their mind frame, and I mean, it's so clear to us as people who talk about this, but it's so clear that that's their trauma as well. And it's like, no, I want to get you through this, but everyone's got to do it at their own pace. But that's why we're all here to kind of again provide that brave space. I love how you put that, Jose. So I think that's super important, and I think that as a collective, if we do kind of keep these conversations going, only good can happen from them. So I appreciate you both. I appreciate the listeners of Live Pono, Love Pono, who are listening on either Spotify or KTUH or wherever you choose your podcast platform. And again, this is Alex. We've been talking about intergenerational trauma in the Asian American and Pacific Islander community. The event will be held on Zoom, and it's August 23rd at 12 p.m. Hawaii Standard Time. The link will be in our Instagram bio. And we're also really grateful to have this conversation with both of you, but with Jose hosting the event, as well as the Peace Building Initiative's YouTube channel. So if you're watching there, thank you so much. Thanks, everybody, and I hope you have a great day.